Thank you, Senator Stabenow. Let me first acknowledge and thank Chairman Baucus's leadership on this issue, and not only making sure that it was a priority, one of the first acts in the Senate Finance Committee, but also for including legal immigrant children, those children who are the sons and daughters of legal permanent residents of the United States who obey the law, follow the rules, work hard every day, and yet found themselves without health insurance. And so this is really, at the end of the day, about working towards our goal that in the greatest country in the world, no child would go to sleep at night without health care coverage. And I appreciate Senator Stabenow's constant effort in this regard, and our national advocates who are here as well. You know, this week the Congress is facing a fundamental test of our values, whether to reauthorize the state children's health insurance program and expand it to cover millions of children who otherwise would be uninsured. These are Americans who work every day in some of the toughest jobs in the country, but their jobs don't offer health insurance and their paychecks don't cover the cost of private coverage. Parents stay up at night worrying about whether the hard cough they hear coming from their daughter's room means she's got asthma, hoping that their pain in their son's stomach doesn't mean that he's going to need surgery, wondering how they're going to pay for a routine checkup, and just praying that everyone stays healthy until they can afford the health care they need. In these tough economic times, state governments are being hit hard, and state programs for children's health are starting to run out. Now more than ever, we need to expand our efforts to make sure no child goes to bed at night without health care. Some of our colleagues may question whether we can afford more health care for our children. Well, let's look at the facts. First of all, this legislation won't cost us a dime. It's completely paid for. Second, making sure kids can get regular checkups and focus on preventive care has the potential to reduce emergency visits and save money down the line. But above all, Americans believe health care should be a national priority. Improving the health of our children is one of the most important investments we can make, and it's essential to help them attain their aspirations and become among the most productive members of our society. Expanding children's health insurance has proven benefit after proven benefit, from high-quality care to better school performance, decreased disparity in care for minority children, and increased availability of cases in rural areas. Now, some people want to change the subject and turn this into a debate about immigration, but it is not. It's about children, children, and children, children who are in our country, both native-born and otherwise legally. When we look past the red herrings, when we see this bill is virtually identical to last year's bill, which won strong bipartisan support, I'm confident we will pass it again. Plain and simple, this legislation is about making sure parents who work for a living, you know, because if you're very poor, you've got Medicaid. If you're wealthy enough, you can purchase insurance. But if you work hard and yet are above those levels, and you're that in-between, and work every day to try to sustain your families and realize your hopes and dreams and aspirations, but don't have a job that produces health care coverage, then you're left in the cold. This is about bringing them into the warmth and ensuring that this is our values. Finally, I hear a lot of speeches on the floor of the Senate about the value of life. Do we value our children, and do our actions match our values? For those who value life, who have spoken eloquently in the Senate about sanctity, and for those who value family, who consider it the bedrock of our lives and our country, now is the time to show the depth of your belief. Because if children's health isn't about protecting life, I don't know what is. This is about a pro-family bill, as you can get, and we expect those who have spoken so eloquently about it to put their votes there on behalf of these children.